Are you looking for professional training in forensic mental health?
My name is John Edens. I'm a licensed psychologist in the state of Texas. I'm also a professor in the Department of Psychology at Texas A&M University, where I conduct a lot of research on a variety of mental health and forensic relevant topics. So what are we going to do today? I'm going to cover, as I said, a bunch of stuff. And what we're going to hit on, first of all, is kind of a basic overview. We've got 2 whole days of information to cover, so I'm going to hit the kind of basics of the design, how the PAI was created. We're also going to talk just briefly about the adolescent version of the PAI, which has been out for a few years. I'm not going to talk a ton about it. There's not a lot of published research beyond what's in the professional manual. There's a few studies that have been done. And then we're going to talk some as well, again, sort of briefly, about the personality assessment screener, which isn't something necessarily that might be used in forensic context, although it probably could be in certain types of circumstances, and talk about some interesting things going on with that. We'll then get into interpretive guidelines for how to kind of make sense of what a PAI profile is and what it tells you about someone, kind of in a generic sense, before we get into a lot more specific details about interpretive information. And then we'll move into kind of more forensic-y issues about why should anybody be allowed to go into court and testify about anything related to the PAI in terms of psychological findings about somebody. And then we'll move into actual kind of specific things related to applied work in terms of assessing psychopathology. What does the PAI tell us about what we used to call Axis 1 and Axis 2 types of mental health types of issues. And that'll take us probably to the end of day 1. If I go really, really quickly, which I tend to do, we might start in a little bit talking about response distortion, what the PAI can be used for, and what it tells you about somebody's approach to the testing situation, and what it tells you about their presentation of response styles. And then we'll go into violence risk and institutional adjustment types of issues. The PAI does have some useful aspects of it that are informative for people that are more versus less likely to act out in a variety of types of contexts. And then we'll talk some specifically about treatment-related issues. I'm not a big treatment guy myself overall. I'm much more of an assessment type person. But we'll hit on some things in regards to what the PAI portends for treatment response. And then suicide risk is also something that we'll get into.
To learn more about Concept's professional training opportunities, visit us at concept-ce.com.